I'm the physician assistant here today. I'll be taking care of you. Can you just state your name, your age, and your race, please?
My name's Haley Camden.
Okay.
I'm 35.
Mm-hmm.
I'm African American, and I'm female.
Okay, great. And what do you do for a living?
I'm a CNA.
Oh, great. Awesome. So what brings you in today?
I was out walking, and I all of a sudden couldn't catch my breath. I was dizzy, and it was just awful. So my friend told me I should come in.
Yeah, definitely. So when did this shortness of breath happen? About how long ago?
A couple of days ago.
Days ago? Okay. And you said you were walking. Were you walking unusually fast or?
That's me and my friends. That's how we exercise. So it's pretty brisk.
Brisk? Okay. And you usually do this, so it wasn't out of the ordinary.
Yeah.
Okay.
It was over the last couple month, I feel like I've been getting slower, haven't been able to go as long.
Mm-hmm.
This last time it was really bad.
It was bad. So were you able to get back up and continue walking? Where you just needed a rest?
Well, yeah, we sat down on the grass for probably half an hour so I could catch my breath again. Then we walked back home very slowly.
Okay. So you didn't go to the hospital or anything? Okay.
Nope.
Okay. And have you ever had anything like this before?
No.
No. Not since it's progressively gotten a little bit worse.
Right.
Okay. And is this painful or is it just feels like you cannot breathe?
It just feels like I cannot breathe.
Okay. So do you feel it here or do you feel it radiating down here?
Yeah, more on my
here?
chest,
chest?
right here.
Okay. And what would you say that this experience feels like? If it was a pain, what would you rate that pain?
It'd probably be just because it's kind of scary, so probably an 8.
I'm sure. An 8, yeah. I feel like not being able to breathe would be pretty terrifying.
Yeah.
Okay, so I'm going to ask you some questions pertinent to those two areas here, because you're having some chest difficulties and breathing.
Okay.
So have you had a cough in the past 6 months?
Nope.
No cough? Okay. Do you have any wheezing?
Just when that last episode.
This past one. Okay. And you're having shortness of breath. Have you ever had a chest x-ray before?
Nope.
No. Okay. And have you ever had an EKG before?
I don't know what that is.
No. Okay. So it's just an electrical, checking the electrical signals in your heart.
Oh, okay.
So I don't think I
got one before.
And I'm assuming you haven't had a stress test before because you haven't had an EKG.
Correct.
Okay. And have you ever been told that you have a heart murmur?
Nope.
No heart murmur. Okay. And do you have any difficulty when you lay down and breathe since that episode?
I normally sleep with 7 pillows.
7 pillows. Okay.
Not really.
So if you were to lay down flat, you wouldn't be able to breathe well?
I don't think so, actually.
No? Okay.
I've always slept with 7 pillows. So.
Okay. So it's not anything normal to lay flat. Okay. You've had chest pain. And does this happen at night ever? When you're sleeping, you feel like you cannot breathe?
Yeah.
Yeah. Okay.
Sometimes it's I wake up and have to
out of breath,
stand up or something.
Mm-hmm.
But then I can't walk around because I know that makes it worse.
Mm-hmm. That aggravates it. Yeah, that's pretty terrifying. Okay, so we just want to get a whole picture of our patients to try and figure out what's going on. So I'm just going to go through your medications, allergies, and some other histories just to really hone in on what's going on. Okay. So we're going to start off with medications. Do you take anything over the counter or any prescriptions?
Nope.
Nope. Okay. Do you use any vitamins or
just
supplements?
The multivitamin.
Okay.
The woman's multivitamin.
Okay, great. And do you have any allergies?
Nope.
No allergies to drugs, food, pollen? Okay, great. So I'm just going to ask you a little bit about your childhood health. Can you tell me about anything you would like to do for fun as a kid, if you had any sad events or anything really important?
Okay. I have 2 siblings, and they're boys, and so I always used to play basketball and football with them.
Oh, very cool.
Yeah.
So you're pretty active.
Yeah, so it's kind of weird not just not to be able to walk around, let alone play sports.
Mm-hmm.
And then my mother did pass away when I was very young.
Oh, I'm sorry for your loss.
And so that was kind of hard on the family, but my dad took over and he was a good dad.
Okay.
So it was okay.
Okay. That's very sad. How old were you when your mom passed away?
I must have been 6.
Okay, so do you remember your mom at all? I know that's very young.
I kind of here and there, if you show me a picture of us, then I'll be oh yeah, I remember that, but not really.
Yeah, that's very difficult. So you have 2 siblings, you have your 2 brothers. Do you know anything about their health right now?
They're
Are
pretty
they doing
good.
okay?
My one brother has hypertension.
Okay. And how old is he?
He's 45.
Okay. And your other brother?
He has diabetes.
Diabetes. And how old is he?
42.
42. Okay. I'm going to go back to childhood history. I'm really sorry to hear about your mom. I know that's difficult to talk about.
Yeah.
So thank you for sharing. Do you know of the vaccinations that you had as a child? I'm just going to name some. It's probably hard to remember. Did you have measles, mumps, or rubella vaccinations?
I think so. I think
You did?
that was like the MMR one, I think.
Yes, exactly. Yeah.
I filled that out for work.
Okay, yeah. Did you have the whooping cough vaccine?
I think so.
Yes? Okay. And the rheumatic fever?
Mm-hmm.
Yeah? Okay. Scarlet fever?
Mm-hmm.
And polio?
Mm-hmm.
Diphtheria?
Yep.
Yes? Okay. Varicella?
Yep.
Okay. And did you have any chronic ear infections as a child?
Nope.
No? Okay. Pretty healthy. Very good. So moving on to adult health, I'm just going to list some conditions and just let me know if anything applies to you.
Okay.
Okay. So do you have any history of hypertension?
A little bit, yeah.
A little bit? Okay. Do you know when you were diagnosed with hypertension?
He said he's just going to watch it.
Okay. So when did he say that?
Probably like a year ago.
A year ago? Okay. And what physician was this? Like your primary care doctor? Primary care? Okay. And so he's monitoring that. How is he doing that? Do you go in for checkups or do you do it yourself?
Yep. So I actually I go in every month and he just does a blood pressure and then I leave.
Oh, okay,
And
great.
he just makes sure that it's all intact.
Do you take any medications for that? No,
Not
just
yet.
monitoring. Okay. Well, sounds like you got a good handle on it. I'm just going to keep moving on to list some other conditions. Diabetes at all?
Nope.
No. Any hepatitis?
Nope.
No. Asthma?
Nope.
COPD?
Nope.
No. Any HIV?
Nope.
Thyroid disorders?
Nope.
No. Do you have a history of any heart diseases such as heart attacks or congestive heart failure?
Me?
Yes.
No.
No? Okay. Sounds like you have maybe some friends or family, maybe?
Yeah,
Yeah.
maybe. They think that my mom actually, that's what she died from.
Oh, okay.
It was like
okay.
that.
It
like
came
they
on
didn't-
really quickly.
Mhm.
Okay. Do you have any history of kidney disease?
Nope.
Any cancers?
Nope.
No? Okay, great. Moving on, for all my female patients, I like to go over your menstrual history and your obstetric history. So can you tell me a little bit about your period, what age you got it from, and how long does it last?
Okay, I got it at age 12,
Okay.
and it was, lasts about 5 days.
5 days? Okay. And would you say that's heavy, light, or kind of in the middle?
Kind of in the middle.
Moderate? Moderate? Okay.
Beginning's obviously heavier, and then it gets lighter.
Mm-hmm. Absolutely. Have you ever been pregnant before?
Nope.
No pregnancies? Do you use any contraception or any birth controls?
Nope.
Nope. Are you sexually active?
Yes.
Okay. I always recommend to my patients just really to consider using condoms, dental dams, or any sort of contraception just to protect you. And if you're not wanting to get pregnant, definitely protecting against that as well. And if that's something you want to talk about further, we can make another appointment and go over it, but it's just something to consider right now.
Okay.
Have you ever had any psychiatric wellness visits or checkups or hospitalizations?
Nope.
No? Okay. Have you ever had any serious injuries or accidents? Okay.
Nope.
No? Okay. Moving on. Have you ever been hospitalized?
Nope.
Before? Okay. Have you ever had any surgeries?
Nope.
No surgeries. All right. And I just want to go over some screening tests. Have you ever had a colonoscopy before?
No.
No. Any mammograms?
No.
No. Pap smears?
Yes.
Yes. Do you remember the last time you got one?
About a year ago.
Okay, that's good. And do you regularly visit the OBGYN or gynecologist?
Mm-hmm.
You
Once
do?
a year.
Once a year? Okay, great. That's awesome. Have you ever had a TB test?
Yes.
You have.
We had to get them for work.
For work, yes. Most hospitals or clinics require that. And when was the last time you got blood work?
Probably a couple months ago.
Months ago? Okay, great. So you already kind of told me about your family history, and your mom passed away, and you have your two brothers who have hypertension and one has diabetes. Can you tell me a little bit about your father's health?
He's okay. He has
He's okay?
hypertension as well.
Okay. And how old is he?
He must be 75.
75. Okay. And how's he doing with his health? I know he's aging a little bit.
He's doing
okay?
pretty good. We try to like keep him active and things, but he does have hypertension,
Mhm.
so it's all about like diet and stuff like that.
Absolutely. That's good. So just moving on to personal and social history, could you tell me a little bit more about your ethnicity? I know you said you're African American. Are your parents from here, or are they not from here? Just tell me a little bit more.
They're from here. We've all been here for like the last couple of generations.
Okay.
Same neighborhood.
Oh, cool. So you kind of know all your neighbors, everyone's friends. That's
yeah,
cool.
there's a lot of family around.
Mm-hmm. Very cool. Where were you born?
In Philadelphia.
Philadelphia. Very cool. What part of Philadelphia?
North.
Cool. I already asked you a bit about your childhood. Can you tell me a little bit more about your education?
Yep. I had a high school diploma,
Okay.
and then I got my CNA certification.
Awesome. When did you get that?
Probably 2 years after graduating high school.
Okay, so you've been doing this a while.
Mm-hmm.
Very cool. So you said you're a CNA. Where do you work at?
Gladwin.
Gladwin. That's around here, right?
Mm-hmm. Very close.
Very cool. So can you tell me a little bit more about your home situation? Where do you live and who do you live with?
I live with my boyfriend,
Okay.
and we have a dog, and we have an apartment, and it's pretty good.
Cool. And do you feel safe in this apartment, like regarding to the safety of your home? Nobody's trying to get in?
Mm-hmm.
Okay.
Yeah, I like having like a boyfriend there and like my dog.
Mm-hmm, you
So
feel
that makes-
safe?
Yeah.
Good. Okay. Since it's common for people in relationships to have a little bit of domestic violence, I always like to ask my patients, do you feel safe in your relationship with your boyfriend? Yes? Okay. Have you ever been sexually or physically abused?
No.
Okay, good. Do you have any history of STIs or STDs, that's sexually transmitted infections?
Nope.
Nope. Okay. And since you regularly visit the gynecologist, I'm sure that they kind of keep you up to date on screenings and stuff. Okay. Do you experience any discomfort or pain during sex?
No.
Okay.
But I do have to say that like I do get shortness of breath from that too.
Okay, yeah. Does that shortness of breath make you have to stop the sexual activity?
Yeah, sometimes.
It does,
I'll just go
okay.
get like a glass of water or something.
Mm-hmm. And would you say that you're not as sexually active because of this debilitating?
Mm-hmm.
Okay. Okay. And do you have sexual relations with men, women, or both?
Men.
Okay. All right. Can you tell me a little bit about your financial situation?
It's pretty good. We get by.
Okay, good.
We're able to pay all the bills.
Good. That's important. And does your boyfriend work?
Yes.
Okay. So you're both contributing. Okay,
Mhm.
great. Have you ever served in the military?
No.
No. Okay. I know, other than walking with your friends, do you have any other leisurely activities that you like to do?
I like to shop, go to the movies.
Okay. Very fun.
Things like that.
What's your favorite movie?
Probably Saving Private Ryan.
Oh, that's a good one. I love that movie. And since these symptoms have been going on, how many stairs do you think you can climb up without having short of breath?
Probably only probably one flight maybe.
One flight. And just walking on like flat ground, how many blocks do you think you could walk without having any symptoms?
If I'm just leisurely walking, probably like 2. If we're
Okay.
doing like when I was exercising, I only got like 1 block.
Okay. So it's pretty severe and impacting your life.
Yeah.
Since the onset of your symptoms, have you had any problems with your daily living, just getting dressed or cooking or anything like that?
No, that's all been fine.
No? Okay. So you can feed yourself and cook for yourself?
Mm-hmm.
Okay. Can you tell me a little bit about your spiritual beliefs?
Catholic.
Catholic? Okay. Do you go to church, or do you have any support groups like that?
Yeah, I go every Sunday.
Okay, cool. All right. Can you tell me a little bit about your diet? Just an example of breakfast, lunch, and dinner.
For breakfast, I probably have like an egg and a piece of toast.
Mm-hmm.
For lunch, I always have a sandwich or a salad.
Mm-hmm.
And then for dinner, I always have, I make pasta or chicken.
Oh, yeah.
Sometimes burgers if we're feeling like we want to
Yeah.
slip up a little bit.
That sounds very good. So you said, I know you like to walk a lot.
Mhm.
Do you do any other forms of exercise?
Nope, not
No,
really,
just
not
walking?
anymore. Yep.
Well, walking is always really relaxing, especially
Yeah.
after a long day.
Yeah.
Can you tell me a little bit about your fluid intake? How much water you drink a day?
I try to drink a lot of water.
Okay.
I probably drink 2 water bottles a day.
Okay. And are these water bottles the standard, like the kind you buy from the store, or do you have a different one?
Yeah, like the plastic Poland Spring water bottle.
Okay. And do you drink any coffee?
Yes.
Okay. How much coffee do you drink?
About 6 cups.
6 cups a day, or
Mhm.
okay. And how much are the? How big are the cups?
Probably like 6 ounces.
Okay.
And that I actually have seen, like, when I drink caffeine, like, I have to sit down again because, like, obviously
Mhm.
your heart goes faster, but
Yeah.
I get, like, very short of breath.
So it makes your symptoms worse.
Mm-hmm.
Is that for every cup, or is that after all 6?
That's normally, I'll maybe cut down a cup if I start to feel it earlier, but normally it's, like, to 6 cups of coffee.
Okay. Yeah. That definitely would speed up your heart rate and
Yeah.
make it worse. Do you practice any other healthcare practices, such as yoga or any herbal medicines?
I've tried yoga.
Mm-hmm. Did you like it?
It was all right. I was kind of bored.
Yeah, it's not for everybody. And do you do any, like, do you go to a chiropractor or any acupuncture?
Nope.
Okay. And I always like to go over with my patients regular safety measures like seatbelts and smoke detectors. Do you always use a seatbelt?
Yes.
Yes. Okay. And do you have smoke detectors in your apartment?
Mm-hmm.
Okay, good. And do you always use sunblock?
Yes.
Okay, good. That can really prevent skin cancer.
Oh,
So
yeah.
definitely always use that. How much tobacco do you use a day?
I probably smoke 3 packs a day.
3 packs a day? And how long have you been smoking these 3 packs?
Probably 15 years.
Okay. And how have you ever considered quitting?
Not really.
No. What makes you not want to quit?
I mean, I've done it my entire life.
Mm-hmm.
I'm still, like, pretty healthy with, like, my food and my exercise, so I figure why not.
Okay. Well, it really has to come from within to want to stop. So if you ever feel like you want to have a conversation about that, we have a lot of tools and information that we can give you just to kind of take the steps that you would need to.
Okay.
How much alcohol do you drink a day?
Probably 2 glasses of wine.
2 glasses. And how big are the glasses?
Probably, like, that big. 6
Okay.
ounces.
Do you use any illicit drugs such as cocaine or marijuana, opioids?
Nope.
No drug use? Do you ever use prescription drugs? Oxycodone?
Nope.
No? Okay. All right. So now I'm just going to go through a lot of questions to go over your overall general health. And
Okay.
hopefully this will help narrow down what's going on with you.
Okay.
Okay. So have you had any recent weight changes?
No, not really.
No? Okay. Have you ever experienced any feelings of unwellness since your symptoms started?
Yeah. Just very, like,
General, not feeling well? Okay.
Yeah.
Have you had a fever?
I don't think so.
No. Any chills?
Nope.
No chills. And do you experience any weakness?
Yeah.
Yes.
Like, when the whole walking thing happened, I
Mhm.
was very weak and I, like,
Yeah.
had to sit down.
Yes. Okay. I'm sure you feel fatigued along with that weakness because you said that you couldn't stand up for
Yeah.
Okay. And do you have any night sweats?
No.
No. Okay. Moving on to your skin, do you have any rashes or lumps on your skin?
Nope.
Do you bruise very easily?
No.
Okay. Do you have any stretch marks on your stomach or your buttocks? No? Okay. Do you have any color or texture changes in your skin?
I don't think so.
No? How about your hair and your nail health? Has anything changed?
No, I think we're good.
Okay, good.
Get them done every week.
Good. Do you have any dryness on your skin?
Nope.
Abnormal dryness? No? Okay. Do you have any extreme oiliness in your scalp or your face?
No.
Okay. All right. Do you ever experience any headaches?
Yes.
Yes? Okay. And how often would you say that they happen?
Since this whole thing, probably like every day.
Wow, okay. And are you taking, you said Advil?
Yeah.
For the headaches?
Yeah.
Okay. Do you experience any dizziness with the headaches?
Yeah.
Yeah? Okay.
And then sometimes no headache, but with dizziness.
Okay. Have you had any trauma to your head?
Nope.
No. Any lesions in your head?
Nope.
No. Have you had any loss of consciousness or fainting?
I don't think so.
No. Okay. Do you wear glasses or contacts?
Yes.
You do. Okay. When was your last eye exam?
About 6 months ago.
Okay. Great. And has your vision changed every year or this past year?
Nope.
Since?
It's pretty
No?
moderated right now.
Good. Do you have any pain when you're going to the get your eyes checked or just every day? No. Okay. Do you have any redness in your eyes?
Nope.
No. Okay. Do you feel like you have any loss of vision on the side of your when you're looking straight ahead?
Nope.
No. Okay. Have you had any trauma to your eyes?
No.
Okay. And do you feel like you can see at night or not very well?
Yep.
Yeah.
I drive home every night.
Okay, good. Do you have any blurred vision or flashes of light in your field of vision?
No.
Okay. And you don't have any discharge?
Nope.
Okay. All right, great. Moving on to your ears. Do you have any decreased hearing in either ear?
Nope.
Okay. Have you had any trauma to your ear?
Nope.
Okay. Do you have any vertigo? It's like kind of like dizziness. You're very off center.
I don't think so.
No. Do you ever have any ringing in your ear?
Nope.
No? Okay. And do you ever have any earaches?
No.
Okay. All right, moving on to nose and sinuses. Do you have frequent colds?
No.
No? Okay. Do you have any sinus problems, infections, or congestion?
Nope.
Okay. Do you have any loss of smell?
No.
And do you sneeze frequently?
No.
And have you had any nosebleeds in the past 6 months?
Nope.
Okay, great. Moving on to mouth and throat. When was your last dental visit?
About a year ago.
Okay. And was everything okay, or was there any abnormalities?
He was concerned about my gums.
Okay.
Because like I never floss, and he said they do look a little swollen, but other than that, not really.
Okay. Have you considered flossing a little bit more since he gave you that advice?
Yeah, I tried to.
Yeah.
It's just kind of annoying.
Yeah, I get that. It's just another step you have to do.
Yeah.
Does it make your gums bleed when you try to floss? Yeah. It does? Okay. Do you have any other pain in your mouth?
Nope.
No? Okay. Do you have any problems with your tongue? It's enlarged or it's sore?
Nope.
No? Any coatings on your tongue?
Nope.
Okay. Any hoarseness?
No.
Okay. And do you brush and floss your... Well, we're trying to floss, but do you brush your teeth every day?
Twice a day, yeah.
Twice a day, great. And do you wear dentures?
No.
Okay. All right, moving on to your neck. Do you have any pain in this area of your neck or anywhere stiffness?
No, not really.
No? Do you have any lumps? Like you can feel it? No? Any thyroid problems?
Nope.
Any injuries to your neck?
Nope.
Okay. Do you have any limited movement of your neck? Just trying to go back and forth like that?
Nope.
No problems? Okay, great. Okay. And this is just the last part of the exam. Going over your breast examinations. Do you ever self-examine yourself?
Mm-hmm.
You do? Okay, great. How often do you say that you do that?
Probably once a month.
That's really good practice, especially as we get older. Women are definitely more likely to get breast cancer.
Yeah, that always scares me.
Mm-hmm. Absolutely. Well, that's very good. You're taking care of yourself. Have you ever noticed any lumps in your breast when you do these exams?
Nope.
No. Any pain or tenderness? Okay.
Very
We'll save
good.
the rest for next time.